So I'm going to perform an EKG right now. So we have this mobile unit. An EKG tells us about the electrical conduction within the heart. So what we're going to do is we have these 3 leads. This white one goes on the right forelimb. I'm going to put it just a little bit below the elbow. It's a little alligator clamp. Okay, the black lead goes on the left forelimb. I'm going to go right below the elbow. And the red lead goes on the left hind limb, and I'll clip it right below the knee. So you need to wet the leads down. We use alcohol. So what we have the dog on a towel to minimize any other conductions. We don't want any other equipment being used. If the dog's shaking, that could give us a false reading. But she's very calm right now in right lateral, and that's the ideal position. All right. So when you're trying to read an ECG tracing, there are 5 questions you want to ask. Is there a P wave before every QRS complex? Is there a QRS complex behind every P wave? Are all the P waves in QRS complexes the same? Are the PR intervals normal in duration, and are they the same? And are the RR intervals the same? Okay, so if you look right here, this is our QRS complex. You can see there's a tiny P wave a little bit before the QRS. There is one before every QRS complex here, and there is a QRS after every P wave. And are all the P waves and QRS complexes the same? Without printing this out and actually measuring it, which would be ideal, but so it does appear that all of the P waves and QRS complexes are the same. Are all the PR intervals normal in duration? Again, it would be best to print out the ECG and measure it, but just by looking at this as it's going, they do appear to be the same. Also for the RR intervals, there does appear to be the same amount of time between each beat. So this is a normal sinus rhythm, heart rate of 90, and that is how you perform an ECG. Okay, so today I'm going to demonstrate the use of the rabies pole. You really only use this if you're dealing with a very aggressive dog or someone who potentially has rabies. So once you get it around the neck, what you would do is you would pull this string here and it tightens it, and then to release it so the animal can go on their way, is you pull this here just like that. Okay, so I'm going to demonstrate it here. So if they were an aggressive dog, I would kind of keep my foot in front of the door. All right. Okay, I'm gonna tighten it up. Okay. All right, come on, pretty girl. Okay, so this is how you would basically keep the dog at a safe distance like this. Okay. And then we'll come back into the cage, and I'll shut the door and release so I can just pop it right off. All right, and that's how you would use a rabies pole. Okay, so what I'm going to perform today is a Schirmer tear test, a fluorescein stain, and tonometry. So for the Schirmer tear test, what this is it's a little paper ruler. And so what I'm going to do is, while it's in the package, I'm going to bend the rounded tip just a little, because this is what I'm going to put under in the conjunctiva. So what I'll do is I bend the tip a little bit while it's in the package. I'm going to open the package on the opposite end because I don't want to touch the part that goes onto the eye. And we will do one in each eye. We keep it in there and measure for a minute. A normal reading is greater than or equal to 15 millimeters over a minute. So we're gonna go ahead and start here. Okay, so I've got my bent tip. I'm just gonna, and Lauren is holding, a lot of times less restraint is better for this. I'm just gonna put it up under the conjunctiva. Perfect. Good boy. And count for 1 minute. Okay, so it's been a minute. I'm going to take the strip out. And he's been diagnosed with dry eye, which is totally conclusive because I got 3 millimeters.
Oh, sorry, bud.
Okay, so what I'm going to do now is repeat the whole thing on the left eye. So what we're going to do now is do a fluorescein staining. So I've got my fluorescein strip here. And so what I'm going to do is I'm just going to bend the strip just a little bit. So when I open it, I can put my drop of water on it and it goes right down onto the orange staining part. Now when I'm staining the eye, I don't want to actually touch the eye with the tip of this. I want the drop to just come off and roll onto the eye. After the stain is on there, we'll have them blink a couple times, and then we will use our eye wash and kind of rinse the extra stain out of the eye. Okay, so I'm being very careful not to actually touch the tip of this. I'm keeping it in my sterile wrapper. I'm going to put my drops of the eye wash on, so then when I pick it up, I can just place a drop in his eye. Oops. There we go. Okay. I'm just going to go over and do it on the other eye. There we go.
Good boy.
All right, so we got the stain in. Okay, so now I'm going to squirt the eye wash to rinse some of that extra stain out.
It's okay,
Buddy, you're not gonna like this.
Good boy, Milo. Gonna get all the treats.
Okay, so now we're going to look at his eyes. All right, bub. So now we're gonna look in the eye. And so the fluorescein staining will tell us if there are any scratches on the eye. Okay. Okay, so that is how you look at the eye after the fluorescein stain. For the final eye test, what we're going to use is a tono pen. So what we do, the first thing is we put a little bit of proparacaine in the eyes. So I'll just do 1 drop each eye. Okay, so the tonal pen, what this is it's a test for the intraocular pressure of the eye. So it tests for glaucoma. A normal reading for dogs is between 10 and 20. So that's what we're hopefully going to get here with Milo. So what we do, every day you should calibrate the tono pen.
Oh.
Okay, so to calibrate the tono pen, you hold it just like this with the tip pointing down. You're going to press this operator's button twice. It will say CAL, and then it takes about 15 seconds, and when it says up, then I flip the tono pen up like this. And then it will tell me if it is a good or bad calibration. So here we go. Good. Boom. Okay. Okay, so now what I do is I take off this little paper top. This is a brand new tono pen cover. So what I'm going to do is have Lauren help open the eye. I'm going to come at the eye at a 90-degree angle and just very lightly tap, and it will beep, and then it will give me a reading.
Sorry, Madeline.
Okay, we got 30. 26. 33. Okay, so that is how you do a total pen reading. His level was 30, so it's on the high end, and we will be letting the doctor know. But that is how you perform the 3 eye tests. Okay, so what I'm going to demonstrate today is placing an emergency bandage. So what I have here on Miss Tittles, I have a little piece of tape here. It's got a little black marking for the wound. So the first thing that we would do is we would use our sterile lubricant, and I would put it in the wound, and that protects it from any of our cleaner and from getting any more hair or debris in the wound. So I would put my sterile lubricant in the wound. I would take my clippers and I would clip all around this wound, making sure to get the hair as short as I can, and being careful not to damage any of the tissue. After we would clip it, we would take our chlorhexidine scrub gauze and our chlorhexidine solution gauze, and I would alternate and clean the wound, starting in the center and working out, making sure not to get any old debris in the wound. And so that would be my chlorhexidine scrub, and then I would do my solution, and I would keep alternating like that until the wound was cleaned. Then I would take my 60 milliliter syringe with sterile saline in it. I would have a plastic catheter tip on the syringe, and then I would continually flush the wound to get all of the debris out. After we did that, I would place my non-stick Telfa pad over the wound, and then I would grab my cast padding. So I'm placing the Telfa pad over the wound. I would grab my cast padding. And I would try not to make any wrinkles in the cast padding. And I would wrap it up. Again, this is just an emergency pad. To keep it from bleeding until we can address the wound. Then I would take my vet wrap and I would wrap okay. So that is how we would clip and clean an emergency wound, and then bandage it until the doctor can reevaluate it. Okay, so for this video, I'm going to apply a modified Robert Jones bandage with a splint. So the first thing I'm going to do is make my stirrups. So I've got my tape here, and I'm going to put it up to the distal 1/3 of the leg. I'm going to place it on both sides. And I'm tabbing the ends so I can separate them easily when I'm done. So I've got my stirrups in place. Now I'm going to place my cast padding. I will start at the toes and I will work proximally. I'm just doing 2 layers, and I'm going to overlap the cast padding about 50% as I go up. I am going to leave a little bit at the end so the toes are exposed so we can monitor them while she's wearing the bandage. Okay, and I'm going to go up here over the elbow. Okay, so I've got my 2 layers of the cast padding with the toes exposed. Now I'm going to use my compression bandage for the second layer. Again, I'm going to start at the toes and work my way proximally. This layer we do a little tighter, and I will overlap it 50% as I go up. Okay, so now what I'm going to do is I'm going to separate the stirrups. And I'm going to twist the tape so the sticky side is down on my bandage. I'm going to do that on both sides. Okay, so I've got the stirrups in place. The next step is for the splint, and I've got a little splint that will fit this dog's size leg, and what we do is we place this on the back side of the leg, and then I will take my vet wrap and wrap that around the leg. For the last step of the bandage, I'll use my vet wrap. I don't want to go too tight with it. So what we do is I rolled the whole roll and then loosely rolled it back up again so I don't make it too tight on her leg. I'm going to start at the toes and move proximally. Again, I'm going to leave the toes exposed so we can monitor them. And also, when I put this up at the top, I'm not going to go beyond this padding because I don't want it to rub against her body and cause any problems. I also want to put the splint down a little bit so when she touches the ground, the splint is there to take the weight. I'm going to wrap up about 50%, overlap about 50% as I'm rolling up. Okay, so that leaves plenty of room up top so my bandage isn't going to rub against her body and cause any sores. And we left room down at the toes, so we can monitor them while she's wearing the bandage. And that is how you place a modified Robert Jones bandage with a splint. Okay, for this video, I'm going to show removing the modified Robert Jones bandage. I did want to add in that you can put a little bit of this elasticon on the bottom for a little bit of traction. So what I'm going to do here is just start unrolling. Okay, so I'll remove my splint. I'll peel down my stirrups. And I can just start unrolling the bandage. And then just peel off the stirrups. Okay, so that is how you remove a modified Robert Jones bandage.
I pushed it.
Okay, so what I'm going to do now is do a role play with Lauren here, doing a dental discharge. So I'm just going to go over these discharge instructions. So Athena, your pet today, we did just a standard routine dental cleaning. We didn't have any extractions or anything. Yes. So when you go home tonight, food and water, because they can get kind of excited after the surgery and then to go home. So just withhold food and water for about an hour. Sometimes they're inclined to eat and drink excessively, and then offer a little bit of water. If she does well, doesn't drink too much, no vomiting, then you can offer her a small meal at about 6 tonight. So feed just soft food only for 24 hours and no chew toys for 24 hours. So for elimination, many patients may not have a bowel movement for a day or two after anesthesia, anywhere from 24 to 36 hours. That's totally normal. If there are no bowel movements after that, please give us a call. We are not sending home any medications tonight because there were no extractions done. We have no sutures. We want to do a follow-up recheck in 10 to 14 days. We do want to have you monitor any decrease in activity or appetite that can happen for 1 to 2 days after anesthesia. However, anything beyond that, definitely give us a call. But some things to watch for are loss of appetite over 2 days, refusal to drink water over 1 day, if there's any weakness, depression, vomiting, or diarrhea. If you see any of those things, please give us a call. We do recommend home dental care. We recommend teeth brushing and to start 14 days after the cleaning, so 14 days from now. Ideally, brushing once a day, but I know that's very hard to do. So we have this CET dental toothpaste that we're going to give you and a little bitty toothbrush. Something that you can do is just get Athena used to having stuff in her mouth. So what we recommend is getting like a little wash rag and just using a little bit of water at first and just kind of, go around her mouth. Do that for several days, once a day. And then you can start to add some of the toothpaste.
Vanilla mint.
Yeah, I know, my dog really likes that
too.
And then hopefully you can work up to a toothbrush, but even just a washcloth with toothpaste is better than nothing. We also are giving you some dental chews. You can do one of these once a day. There's a couple different brands. The Hills Prescription Diet, there's a CET brand, and then there's an Oravet brand. But these are what we're going to give you today. Okay. So do you have any questions?
No.
Okay.
Yay.
All right, so I'll bring Athena up to you.
Thank you.